Hi everyone, my name is Rebecca Howe and I'm the Liaison Librarian to the School of Health Professions. This short tutorial video is about evidence-based practice, also known as evidence-based medicine. And we'll just be going over a short overview of what it is and how to use it to create a good search strategy. So evidence-based practice has three equal parts. There is the clinical expertise, which is your knowledge, skills, and expertise. The unique patient characteristics, which is the unique preferences and concerns of your patient. And the last part is the best evidence, which is the valid and clinically relevant research. You will see that all three parts are equal to create the evidence-based practice here in the middle. So the best evidence piece is the piece that we'll be talking about today and that the library can help you with. There's the evidence-based cycle, also known as the 5 A's. We have the assess piece where you assess your situation, ask or define your question, then acquire the best evidence by selecting your resources, designing a search strategy, and searching for the answer. And then appraise or summarize the evidence yield, and then you'll apply the evidence to your question. And you may need to reassess and start the cycle over. And notice that it is all centered around the patient. The acquire piece is the piece that we can talk about today with the library's help. So the steps for acquiring evidence are laid out here. First, you identify your clinical problem, create your well-defined research question using the PICO acronym, which I can show you next how to use. And then you'll translate PICO into a search strategy by brainstorming and gathering your synonyms, constructing the search strategy, selecting which databases to use, and then tailoring that search strategy to each database. The hierarchy of evidence is a core principle of evidence-based practice. The evidence pyramid provides a way to visualize both the quality of evidence and the amount of evidence available. As you move up the pyramid, the study designs are more rigorous and less biased. And you can see that the ones at the top, the study designs at the top, have a stronger methodology. There are different types of clinical questions. There are therapy questions, which look at a treatment or therapy for a disease, diagnosis questions that look at a power of a test to differentiate between those with or without a disease, prognosis, which is what is a patient's likely course of treatment over time due to factors other than interventions. And then you may have an etiology or harm question, which looks at the effects of a potentially harmful agent on the patient. For example, smoking. What are the effects of smoking on a patient? And the type of question will determine the type of study that you should use to answer that question. So this chart shows you the suggested best type of study to answer a study question. So for example, therapy, that is recommended to use randomized controlled trials over a cohort study. And remember that any questions of therapy and prevention which are all best answered by RTCs, can also be answered by a meta-analysis or a systematic review, which look at randomized controlled trials. This is our list again of the steps for acquiring evidence. So once you've identified your clinical problem, you want to create a well-defined research question. And the best way to do that is to use PICO, which, if you have not heard of it before, it's an acronym and it stands for patient, or P for patient or problem. So you first describe your patient or your problem. You have an I for an intervention, like a therapy or a treatment or a cause, prognostic factor, etc. You may or may not have a comparison. You may be comparing two treatments or two drugs or medications. And then the last one, the O, is for outcome. So what improvement or negative effects does the therapy or treatment have? So the only one that is not necessary every time is going to be the C, the comparison or control. But you should always have the other three to make a good clinical question. And having a good question outlined with PICO will help you have a good search strategy later on when you're searching the literature. So let's try an example of a good question. So in adults with out-of-hospital cardiac arrest, does pre-hospital therapeutic hypothermia improve rates of survival to hospital discharge? So let's think for a minute, what is our P, or a patient or problem in this case? It's adults with out-of-hospital cardiac arrest. So what is our intervention? And in this question, we're asking, does pre-hospital therapeutic hypothermia improve rates of survival? So our intervention is the hypothermia, and there's no comparison in this case. We're not comparing any other therapy or drug. And then the outcome would be survival to hospital discharge. So improving rates of survival. So now that we have our question translated into PICO, we are going to use that to create a good search strategy. And the first thing we need to do is brainstorm and gather our synonyms, and then we can construct the search strategy that we'll then use in the different databases. So the reason that we need to gather synonyms is because not all articles or authors or journals use the same words for the same concepts. And so if you have synonyms, you can cover your bases and get a broader search and a broader range of articles. So I have a chart laid out, which is a nice visual way to gather synonyms. Usually when I do this for a search, I will just type out a Word document and put one term or concept and then underneath list all my synonyms so that I can copy and paste them. But I like using this for the lesson because it has a nice visual. So the P I've put here in the first column, which is adults with out-of-hospital cardiac arrest. So our term is out-of-hospital cardiac arrest. A synonym for that would be an acronym. So if there is an acronym for a term that is common in the literature or commonly used, you can use that as a search term. And the I is our pre-hospital therapeutic hypothermia, which we can simplify as hypothermia. And if needed, we can then later go back and add the full term, but hypothermia may be enough to get us a good set of articles. And targeted temperature management is another way to say that. So we've got at least one synonym right now for each of these terms. And you don't need to fill up the whole table, but it is recommended to have at least one synonym for each term if you can. In this case, we have no comparison, so we'll leave that one blank. And our outcome is to improve rates of survival. So sometimes you will have an outcome that is vague or general, and then you may not include it in your search. In this case, we can go ahead and add the term survival and maybe even hospital discharge to see if we can find some good articles. But just remember that even though you will always have your P and your I, and if there is a C, you need to put those terms in your search, you sometimes can leave out the outcome depending on what it is. So now that we have our synonyms, we have to think about how we're going to construct our search and put the words together. So this is a visual that I like to show to help explain how or and are used in database searching. So you can see in this first example, the term stress and the word stress or the word anxiety, if you put or in between those two words, you'll get a broader set of articles that encompasses all articles with either one of those terms. And sometimes articles with both terms in them, right? But if you use and in between those same two words, you're only going to get articles that have both words in the same article. And any word that has stress, any article that has stress, but not the word anxiety in it will not come up. Similarly, if you have an article that has the word anxiety, but not stress, it will not come up either. And then the last one is not, which I use sparingly. And but the way it works is if you look for stress and not anxiety, you'll only get articles with the word stress. So any article that also has the word anxiety will not come up. So this is just an idea of how and or work. So then you can build your search using your synonyms in this way, where you put or between the synonyms for the same concept, and then you put and in between your major concepts. So this search will bring up articles that have either one of these terms and must have either one of these terms, and they must have either one of these terms. It could be any combination, but it has to be one from each line, at least one or more from each line. And I like to write this out in, again, a Word or Google Docs, some kind of document, so that I can copy and paste it easily into my different databases. So now we are going to think about which databases we want to use, and then we will select them. And then I will go in and show you how to translate this search into each one.